So sometimes it's so hard because newborns it feels like they're feeding all day, every day, but their tummies are so small. So that's normal. And so I think it is important to know the difference because it feels like they're not most of the time in those early days.
Hey everyone, and welcome to yet another episode of Entering Motherhood, a podcast dedicated specifically to new moms going through this amazing journey in life. I'm your host, Sarah Bilger, a postpartum nutritional coach / mechanical engineer. And as always, I'm so excited to be here with you and share all of the information I've been lucky enough to obtain since becoming a mom. In this episode, we talk with Sarah O'Rourke about breastfeeding and how reaching out to a lactation consultant might be the right option for you along your journey. Hello and welcome to Entering Motherhood. I'm so happy to have you here and really get this conversation started. So, how about you go ahead and introduce yourself?
My name is Sarah O'Rourke, and I'm a certified lactation counselor as well as an internationally board certified lactation consultant. I basically got started because I'm a mom and I was breastfeeding, and it was a lot harder than I thought it was going to be. My first child, I did not meet my breastfeeding goals, so I knew when I had my second that I wanted to reach out and get some support. And that kind of just inspired me to be that person for other breastfeeding moms because I think so many times we think that because it's natural and normal, that means this can be easy. And that's really not the case at all sometimes. So that's kind of how I got started. And I really just love supporting moms in their postpartum journey and their breastfeeding journey and helping them meet those goals.
Awesome. Yeah, I definitely agree. We do kind of like think it's this natural process. And, me going into motherhood, I was kind of like, oh, yeah, I'm going to breastfeed and that's how it's going to be. That's what we're going to do. And I didn't really think about the logistics of it and what all goes into it. I thought, they said baby will just latch on and just start going. So when there were kind of like hiccups and things going on, I was confused. I was like, am I doing it right? Is this going on? And even being in the hospital and having somebody kind of like be there to help me immediately after, I felt almost as if I was supposed to do some homework beforehand. They were like, "Oh, well, have you practiced like hand expressing or like is any of your milk coming in?" And I was clueless. I was absolutely, kind of like, I have no idea. Like, you tell me. And I think, a lot of the times moms are in that situation. We've never come across this. We've never been exposed to it. We've never physically, maybe we've known someone that's breastfed or seen somebody breastfeeding, but we've never physically done it ourselves.
Absolutely.
So what can you kind of suggest for moms, maybe they're still pregnant, they're expecting to breastfeed. What would you suggest on how they can prepare and what they can be doing now?
Yeah, that's a great question because I think sometimes when we do wait until we run into trouble, we're so overwhelmed by just postpartum emotions and the stress of a new baby. Maybe it's your second baby and you're trying to juggle that transition. So I think just getting support early, maybe that is during pregnancy. Maybe you don't necessarily want the support during pregnancy, but look up some lactation consultants in your area, or if there's no one in your area, telehealth is really becoming more common now. Just look up some resources and have them on hand. Put them in your phone. Everybody's got their phone, especially when you're sitting there breastfeeding. So make a little note in your phone of a list of lactation consultants and their number. That way you have it. Maybe even consider a prenatal breastfeeding class. There's a lot of lactation consultants that do offer them. So that's a great option. I think a lot of times, like you said, people don't know the resources that are out there or they just don't think they'll need them. So I would just say being proactive, whether that's taking a class or just having the resources conveniently located where if you need them, you have them. And then the other thing is there's resources like books. I really like The Womanly Art of Breastfeeding. That's a really great resource. If you like reading and that's more your style, some people just a little bit introverted. They don't want to go meet with somebody unless they absolutely need to. So that's a good option as well.
Great. So you said, finding a lactation consultant in our area. Is there an easy way to do that? Is there a main website that we can find, you know, people in our area, or how does that work?
Sure, that's a great question. So, typically, there are different breastfeeding coalitions. Here in South Carolina, there's South Carolina Breastfeeding Coalition, and most states have those. La Leche League is another great resource to find lactation support. And honestly, you could just Google most of the times lactation consultants in my area. If you are somewhere where you might not have somebody, I would probably go the route of using something like a Google search or the Breastfeeding Coalition or something like that. But yeah, there's definitely a lot of online resources. Like I said, La Leche, Breastfeeding Coalition, stuff like that. So
Great. And for a prenatal breastfeeding class, what would kind of go into that? What would you be learning and being exposed to in that sort of class versus, maybe a generic just birth preparation class?
that's a great question. So, what I cover in my class is usually kind of just what to expect. There's so much talk of has your milk come in? You mentioned that earlier. So, what does that mean? Most moms think when they hear that they're what they have is not milk, when that's not really true. So, just kind of dispelling some of those myths about breastfeeding, talking about when to seek help, what are some signs that you need to see a lactation consultant, what is normal, what is not normal, what are signs of a good milk supply, what are signs your baby's getting enough, those kind of things. We would always cover different positions. There's not really a right way to hold your baby when you're breastfeeding for the most part, but there's so many different ways, and it's going to be different for different moms. So kind of just going over basic positionings, basic latch, what a good latch looks like, those kind of things. Yeah. Oh, and then also, if you have a partner that's really involved, I always invite them to come because it's so important to have that support and kind of go over what they can do to help.
Awesome. So we kind of had a few people reach out and get some questions going in preparation for this recording. So, and that's really fun and exciting. Something that we didn't try before, but it's definitely something that I want to start incorporating into these episodes. So, basically, a lot of moms were sort of asking, like, what should I be looking out for? Or when should I be seeking a lactation consultant? Like, when is it a point of, maybe something's a little off or I do need that additional support? Other than maybe just kind of like sensing it and saying, like, hey, this doesn't seem to be right. Maybe I need to like contact somebody. What are some, I guess, signs that you
Sure.
could really notice and be looking for your help?
Yeah, so I think we used to, and I'm happy to say that I think this myth is being dispelled a lot lately. So that's great. But we used to tell moms that it was okay that their nipples hurt or were sore, or even bleeding, and that they just needed time to toughen up. And I'm glad that that is kind of dissipating that myth, but we still hear it sometimes. And so, definitely, number one red flag, if your breasts or your nipples are hurting or bleeding or cracked, that is not normal. It's common, but it's not normal. So, that is kind of that number one red flag. If you're having a lot of pain, definitely reach out for some support. If your baby is not having wet diapers frequently, at least a couple poopy diapers a day, though they may not be getting enough milk. If you just feel like, things aren't right, if you feel like your baby's constantly upset or screaming or fussing at the breast, that might be a good idea to reach out to a lactation consultant. And if you suspect any sort of oral ties, that's also really good to reach out to a lactation consultant. Sometimes pediatricians just don't know because that's not what they went to school for. So if you're breastfeeding and you suspect a tie, I definitely reach out to a lactation consultant.
Awesome. And so, how can we tell if our baby is getting full or if they're getting enough milk or, if our milk is coming in at all? How can we look at that and find out?
So sometimes it's so hard because newborns feel it feels like they're feeding all day, every day, but their tummies are so small. So that's normal. And so I think it is important to know the difference because it feels like they're not most of the time in those early days. But if your baby's feeding at the breast, if your breast feels softer after the feed, if your baby seems relaxed compared to the start of the feed, and a lot of times you can look at their hands and you'll kind of see their hands be a tight fist at the beginning of that feed. And then by the end, they'll kind of open their palms and relax, and their whole body posture should kind of just relax at the end. That's kind of a sign of satiety. That there's some fullness. Now that may go away in like 10 minutes because their tummies are so small and they don't stay full for that long. And that's okay. But as long as you're seeing kind of that change from that really tight body posture, those tight fists, lots of rooting and kind of turning side to side, those are all hunger cues. If you see those kind of go away as the feed progresses, then you can be sure that your baby is getting some milk and doing what they're supposed to do. Those wet and dirty diapers, like I mentioned before, those are really important. So looking out for those. And again, your breast, they should feel fuller at the beginning of the feed and softer by the end of the feed. So those are three pretty good indications. And again, if you're at all worried, it doesn't hurt to reach out for help. Most lactation consultants will give you a quick phone call, usually for free. I know I do. So if it's just like, I'm not sure, just reach out for help. It doesn't hurt, right?
What if they're also not sure kind of your range of services? Like, we're struggling with breastfeeding or, we just have some questions. What range of services do you kind of cover? Like, where does that stop and end in how you're able to assist them?
So do you mean like as far as what type of services I have, or can you elaborate a little?
Yeah, I guess I'm just trying to figure out, like, you go to a dentist, like they work on your teeth, like, it has everything to do with that. Like, what is your, I guess, range of what you would cover? Like, what can we go to a lactation consultant specifically for versus like maybe it's more the pediatrician that we would go to or, like another service that would be needed?
Sure. Okay. That's a great question. So, we would definitely be able to go over latch positioning. We would be able to do, I mentioned ties earlier, tongue ties, lip ties. Those are becoming so much more common and understood. Lactation consultants are usually, if you're breastfeeding, they're usually kind of the go to for that because we can do an assessment to understand functionally, is there an issue. Sometimes it's like, oh yeah, there's a frenulum there and it looks like it's tight, but is it affecting breastfeeding? So that's definitely something a lactation consultant would be able to help with. Returning to work, starting that pumping schedule, figuring out when to pump, how much to pump, how often to pump, those kind of things. Goodness, what else? Weaning, even teething. We cover really a lot of different things. Pretty much, if you're breastfeeding and it's not a medical issue, I would say your lactation consultant should be able to help. Even honestly, if you had like mastitis, you still could see a lactation consultant. And if we needed to refer you to a provider, then we could, because sometimes it's not mastitis, sometimes it's a clogged duct or various other things. So there's really a lot that we cover. Hopefully that answers your question.
Yeah, yeah, definitely. And then another question that had come up is how can dads or partners help support the mom that is breastfeeding? What are some things that they can do on their end?
Yeah, I love that question because that means that dad or partner wants to be involved, which is so amazing and so important because it really is a team effort. And so just having that support, I can tell you, makes such a big difference. Honestly, it's the little things, just read the books, talk to the lactation consultant, like understand everything that mom understands. That way, when she's struggling and she's doubting herself, you can say, "Oh no, the baby's having plenty of poopy diapers. You're doing a great job." Just that emotional encouragement is so, so important. Bring her snacks, bring her water. If you have another child running around, help them out so she can really just focus on breastfeeding. I would say just as much other things you can do that are not breastfeeding, do them, because then she won't feel like, oh, I haven't done laundry in like 3 days or a week or whatever. I really need to do laundry. And then she's got to decide, like, do I feed the baby or do I hold off and go do the laundry? Do all those things that she would otherwise have to do, and support her that way for sure.
Awesome. And then you had said earlier, like some of these things that we're seeing are common, but they're not normal. So you were saying, like your nipples hurting or bleeding or cracked or things like that. What are some other things that maybe, you're talking in a mom group or you have some mom friends and they're like, oh, yeah, like that happened to me. Like that's so common. That's this and that. Like, what are some things that you have seen that moms have struggled with that have been told, oh, yeah, that happens to everybody, or that's so common, where it's not actually normal and it doesn't need to be occurring and we don't need to be struggling with those?
Yeah, I love that question. So I would definitely say perceived low milk supply. There is true low milk supply, and those women need to be supported, and that can be an issue. But I would say, generally speaking, most moms that think they don't have enough milk, they just don't have support. That's really what's missing. It's not the milk. So I think that appears common, at least, that need to top off with formula and to supplement, when really it's not low milk, it's just low support. So I would say that that is something that we see commonly.
And then you were also saying that you are able to help with a pumping schedule and, like getting feeding schedules and stuff. What does that just generally look like in the first maybe few weeks, few months? Like, how often are we feeding our babies? How much should they be consuming? And then if we're switching to pumping, how often do we pump versus we were doing feedings? Can you kind of give like a little elaboration on maybe what that might look like?
Yeah, so a lot of pumping and output and how much milk you're going to give depends on how old baby is, how much they weigh, when exactly you're returning to work. Different lactation consultants have different methods. I always like to recommend, if you have a maternity leave that is set for a certain amount of time, take that leave and cut it in half and start pumping about halfway through. Just to give yourself, because pumping is a learned skill. So sometimes it takes time for your body to learn to respond to that pump. I also would want to help moms find resources, because a lot of times they don't know that they could potentially get a free breast pump through their insurance or through different organizations. So that's something I would encourage them to explore and help them find those resources, because I feel like sometimes those resources go unused just because people don't know that they're there. As far as giving milk in a bottle, sometimes that's a transition. If baby has been breastfeeding for several weeks, they might, it might take some time to adjust to the bottle. There's different bottles that kind of help protect the breastfeeding relationship, and different, what we call paste bottle feeding is a kind of method to bottle feed that helps protect that breastfeeding relationship. So I would go over those kind of things. The pumping schedule really would be like customized to that person's needs. How often can they realistically pump? How often does their baby need to feed, depending on age and weight and those kind of things?
What about, kind of how long milk can stay out or, like if we just heated up a bottle and now it's sitting out, like what does that protocol kind of look like?
Yeah, so it's different for room temperature versus refrigerator versus freezer, and there's different guidelines depending on which organization you're going with. But I would always provide those to clients that, that need those. Typically it's like 6 to 8 hours at room temperature. And whether or not how long you have before you can, like if you started a bottle, for example, it would be different than not using the bottle and then reheating it, if that makes sense. So it kind of just depends, I guess is the best answer. In a deep freezer, you usually get about a year. In a regular refreezer, 6 to 8 months.
Awesome. And then I always heard like Rosie had a little bit of like baby acne, if you will, like call it and everything. And like I had heard like our breast milk we can use for those kinds of situations. Is that something you have learned or you kind of, express to your clients, or are there other uses for breast milk other than, just solely feeding?
Yes, absolutely. So breast milk is kind of like the miracle stuff. I always try to tell my clients not to dump your breast milk. That's like a huge it's a huge waste. It's so much hard work, and it's really a labor of love pumping. So yes, you can. I've used it on for ear infections. I've used it for like clogged tear ducts, and then skin issues in a bath, all those things. It's pretty much good for anything. So, also, if you freeze breast milk and use it in like one of those mesh feeders, it's amazing for teething.
So you said don't dump your breast milk. I think a lot of people have heard like the whole phrase like pump and dump. When should we be doing that? Should we be doing that at all? What is kind of like, I guess, a guideline as far as like if you're consuming alcohol or maybe if you're sick, like do we stop? What goes on there?
Right. So again, that's going to be a really specific question. Generally speaking, there are not very many circumstances where you need to dump your breast milk. There's going to be a few times where there's just no way around a medication that's contraindicated, but usually you can even use that like in a bath. The Infant Risk Center is a really great resource, and they have an app that is called Lactmed. And then there's another one called Mommy Meds. Lactmed's free. Mommy Meds is like $3.99, I think, in the App Store. So both, either free or inexpensive. And I would, if you're a breastfeeding mom, download that on your phone for sure. Most medications are going to be in there, and it will break down what we know about that drug and how it interacts with breastfeeding, and if it's safe, why, if it's unsafe, why is it unsafe? Is it just that some cold medicines can lower your milk supply? So you might say, well, it's worth it. I have a really good supply, but I'm dying over here and I have this cold. So you might say, I'm just gonna, really breastfeed as much as I can to keep my supply up, or pump a little extra and take the Sudafed. But that is a really great resource because it is backed by the Infant Risk Center. They are really a great resource to just know what is safe and what is not. Sometimes pediatricians just don't know. Honestly, it'd be impossible to know every medication that's contraindicated for breastfeeding. Most lactation consultants don't even know, and that's kind of our thing. So that's a really great resource. I think you mentioned feeding while you have a cold. That's totally fine. In fact, if you're up to it, it's really encouraged because your body's making antibodies for that cold, and you're passing those to babies. So that's wonderful. Take care of yourself, stay super hydrated when you're sick, and eat nutrient dense foods so your health doesn't suffer. But definitely keep feeding your baby if you can.
What are some maybe generic ways that we can increase our milk supply? I know that's probably going to like differ, from mom to mom, but I think a lot of people struggle with thinking that their supply is down. And you did also say, like, true low milk supply. Can you kind of go into that and maybe give suggestions on how we can be increasing our supply if we feel like it's low?
Absolutely. So, the biggest way to increase your milk supply is just milk removal, frequent milk removal, and stimulation. So that means feeding your baby often, making sure you have a good deep latch so they are removing that milk effectively. If you feel like for some reason that your baby is not removing the milk effectively, maybe that's a tie, maybe they have some medical thing going on, it's always good to find out the root cause of that. Why is my baby not removing the milk? But in the interim, you can pump a little bit to remove the rest of that milk. Feeding at the breast and pumping are the two most important things to increase your supply. And then the third I would say is skin to skin. That is, when we talk about that magical hour or the golden hour, or, different things right after birth where they put baby skin to skin on mom, and it's so good for bonding and closeness. It's also really good for your milk supply, and that doesn't have to stop, right after a baby's born. It is so calming for them, and it's so good for your milk supply. So if you're really struggling, just kind of get in bed skin to skin with baby, or get in a bath skin to skin with baby, and it resets you, it resets baby, and it can be really encouraging for your milk supply. If you've ruled out a tie or something going on with baby, and maybe you are one of those people that truly just has insufficient glandular tissue, or something going on where your body just isn't making enough milk, you can talk to a lactation consultant about different supplements and herbs that you can take. But that's typically a last resort. You really want to make sure there's not a milk removal issue first before even going down that road.
So, what if we have a clogged duct or more serious kind of complications going on there? Is that something that you assist moms with? And what would that kind of look like?
Right. So for a clogged duct, for sure, I could definitely assist mom. Mastitis, I would say it would depend. It would depend. Some moms don't want to take an antibiotic and they want to try to treat it naturally. So in that case, I would kind of walk her through some options. But clogged ducts, for sure, there's saline soaks. There's kind of, I don't know if you're familiar with the Haka. I say it's new, but I guess it's not that new. It just feels like a lifetime ago that I breastfed, because they didn't have the Haka when I breastfed, so it feels new to me. So the Haka, I've seen people do the saline soaks with the Haka, and that kind of is like a double. Has dual purpose because it uses the suction of the Haka and the health benefits of the saline, so it kind of pulls the clog out while it's treating with that saline solution. So that's a great option. Dangle feeding is another great one. So, kind of using gravity, just leaning over your baby in kind of an all fours position. You can use pillows to support. And then also feeding baby where their nose is kind of pointing towards that clog, using just different positionings to remove that clog are usually all very effective options.
Awesome. Yeah, I mean, after you said like that dangle feeding and stuff, it does like make me remember back to, feeding Rosie and having to do those sort of things, or, just having like that one like awkward spot that's just seeming like it's not coming out, or something's going
Yeah.
on.
Yeah, yeah. Something else I didn't mention is definitely gentle massage and heat, while you're feeding to kind of work those clogs out. That's a good option as well.
What other things do you kind of like suggest for a new mom that's just starting this breastfeeding journey, or even just, advice for moms in general? It doesn't have to do with, breastfeeding and everything, just, your experience, things that you struggled with, and just like kind of words of advice or wisdom that you'd want to pass on to maybe your past self and wish that you knew then.
Yeah. ask for help. Don't be embarrassed. If your neighbor says, "Oh, I can make you a dinner, or I can fold your laundry." Yes, say yes. Just say yes. It's fine. Let them fold your underpants. It's okay. um, don't be afraid to take people up on their offers to help. That is a big thing. And get yourself a good baby carrier, especially if this is not your first baby. Even if it is, I would say baby wearing was a lifesaver for me with both of my children, but especially with my second. And there's resources out there. I actually need to see what the name of the group is in South Carolina, but I believe there's a baby wearing organization where you can bring your baby carrier. They can show you how to use it. They can show you different tricks and positions and stuff. Having those hands free, I feel like is so important because you can have your baby close to you where they want to be, where they're not screaming and they're content and happy, but you still feel like you have time to make yourself a snack or, throw the laundry in or throw some dishes in the dishwasher. It's a really great tool. And just give yourself grace. It's okay if your house doesn't look like HGTV when you've had a new baby. Your job is just to be a new mom and to focus on your baby and to recover because you just gave birth. And it's okay to do nothing.
Awesome. And then I guess kind of, when would be a turning point of maybe we do need to supplement with formula, or, like we aren't producing enough, that maybe like breastfeeding is too hard for us to continue with?
Yeah. So that's a tricky question because everybody's so different. I would say if your goal is to breastfeed, that reaching out to a lactation consultant is really important because you need to know how much to supplement and you need to know why you're having to supplement if there is a why. Again, sometimes there is a true issue with supply and maybe that's just how it's going to be, but breastfeeding's not all or nothing. So if you want to breastfeed and maybe you do have truly a low supply, you can do both. But I think working with a lactation consultant in that scenario is so important because you want to make sure that you're not giving too much supplementation or too little supplementation. So I think that answer is going to vary case to case. And I think working with someone that's trained in lactation is just really important in that scenario.
Awesome. Did you have anything else that you wanted to add, or any other questions that maybe came up?
I didn't get any more questions. I think I answered all the ones that we got over here. So yeah, that's it. I'm thankful that you're doing this podcast, Sarah. I think it's so important. I know we talked last time about that missing support in the postpartum period and how it's so lacking. And I love that you're doing this. So moms have a resource to just feel not so isolated and like they're not alone when they're going through these things. So I guess just thank you for doing what you're doing. And thank
Oh,
you for having
thank
me on.
you. Yeah, yeah. So obviously you're local to the Greenville area. So, if we're not from the Greenville area or anything like that, like how, or even just in general, like how can we get in touch with you? Where can we reach you? Where are you at on social media? All of that information.
Yes, so I have a website. My page is Rising Song. So you can find me that way through Google. You can also find me on Facebook, same name, Rising Song, or Sarah CLC IBCLC on Instagram. You can share my phone number. You can reach out. My email address is so'rourke315 at gmail.com. And you can also find me on the Lactation Network website.
Perfect. I will be sure to put all of that in the show notes and to share all of your information. So, again, thank you so much for coming on and really just talking with us, and getting all that information out there.
You're welcome. It was great.
Well, this wraps up yet another episode of Entering Motherhood. I hope that you have found this episode helpful, and if you liked it, please share it with others who might also benefit from this information. If there's anything that you'd like to know more about, or maybe you know someone who'd like to be on the show, please visit my website, enteringmotherhood.com. I'm so thrilled to be going on this journey with you and getting the amazing opportunity to help moms during this postpartum experience. You can also now find us on Instagram and Facebook at Entering Motherhood.